Vaccinate yourself, like we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be your own. If you from the VI and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together. So we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, like we go.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5. Good day, Virgin Islanders, at home and abroad. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of August 9th, 2021. Joining me for this afternoon's update is Health Commissioner Hussein Encarnacion and Executive Director Raymond Williams of the Virgin Islands Lottery Office. Right now, we're going to go straight to the Commissioner to find out what our status is today in COVID in the territory and our vaccination rate. Commissioner?
Good afternoon, everyone, and thank you, Governor Bryan. As of August 4th, 2021, a total of 151,851 tests have been conducted in the territory. Of those tests, 4,960 individuals have tested positive, and 146,891 have tested negative. The current 7-day positivity rate is 5.48%. This percentage continues to fluctuate, with a high of 5.67 on August 3rd. So we must continue to do the following: wear your mask, wash your hands, practice social distancing, and of course, get vaccinated. That one is with a big exclamation point. There are currently 336 active cases in the territory, 201 on St. Thomas, 121 on St. Croix, and 14 on St. John. 336 is the highest number of active cases we've ever had. We have come so far, and so this figure is truly daunting and somewhat frightening for those who have not taken the public health warnings seriously. 4,584 cases have recovered, and unfortunately, there have been 40 fatalities. And when I say that you have not taken, or many of you haven't taken the public health warnings seriously, I mean that you tend to take it more seriously when those of you or around you are affected by COVID-19. 40 family members have actually been severely affected through death. Do not allow that to happen to you. These deaths have occurred among Virgin Islanders who we know and love. We have the tools to prevent severe illness and death, and I'm encouraging you all to take advantage of the tools that we have available. The department's epidemiology hotline remains open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19 at 340-712-6299 or 340-776-1519. Please remember, testing immediately after close contact with a positive is not recommended. I receive a lot of calls. Oh my gosh, my husband, my wife, a friend of mine's got COVID yesterday, it was positive, I need to be tested today. It doesn't mean that because you're tested the day after exposure, that is going to not test positive for you within 3 to 5 days. You will still have to be repeated in terms of testing or quarantine for the set amount of time that our epidemiology team recommends for you. If you are not sick at all, you can test out of quarantine 7 days after your exposure to the positive. We do not, however, test you again if you are positive and in quarantine prior to coming out of quarantine, and we let agencies as well as departments know that all the time. You will receive a release letter from the epidemiology department of the Department of Health. Symptoms to be aware of are runny nose, fever, cough, headache, tiredness, sore throat, loss of taste or smell, abdominal pain, or diarrhea. This is like starting all the way from the beginning, so we need to do so. If you are experiencing any of the above symptoms or combination of symptoms, please stay home except to get medical care, and of course, give a courtesy call to ensure you are placed in a separate area while waiting to be seen. Do not go to work, school, or public areas, and do not use public transportation or taxis. Separate yourself from other people and animals in your home. As much as possible, stay in a specific room away from other people in your home. If possible, use a separate bathroom. If you must be in the same room as other people, wear a mask to prevent spreading germs to others. Call ahead before testing, before visiting a doctor like I said. Tell them that you have been or may have been contacted with COVID-19 or that you think you're positive, so they can prepare for your visit and take steps to keep other people from being exposed to infection. Wear a mask. You should wear a face mask when you are around other people. For example, sharing a room or vehicle, or pets, and before you enter a healthcare provider setting. This, of course, is even if you have been vaccinated. CDC changed their guidance last week. If you are not able to wear a face mask, for example, because it causes trouble breathing, and that, of course, is because you are severely ill, then people who live with you should not stay in the same room with you, or they should wear a face mask if they enter your room, and of course, you should seek medical advice. Cough, cover your coughs and sneezes. To prevent spreading germs to others, when coughing or sneezing, cover your nose and mouth with a tissue or your sleeve. Throw used tissue in a lined trash can and immediately wash your hands with soap and water for 20 seconds, or use alcohol-based hand sanitizers if soap and water are not available. You should use soap and water if your hands are visibly dirty. Wash your hands often and thoroughly with soap and water for at least 20 seconds. Remember the song that we used to sing? The Mary Had a Little Lamb song? Please do so. Use alcohol-based hand sanitizer if soap and water are not available and if hands are not visibly dirty. This is just a repetition. Avoid touching your eyes, nose, and mouth in unwashed hands. Avoid sharing household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with other people or pets in your home. These items should be washed thoroughly after use with soap and warm water. Monitor your symptoms. If illness gets worse and you have trouble breathing, chest pain or pressure in your chest, shortness of breath, or loss of speech or movement, get medical care right away. If you have a medical emergency and need to call 911, notify the dispatch personnel that you have or been evaluated for COVID-19. If possible, put on a face mask before emergency medical services arrive. These recommendations should be followed until the health department confirms that you do not have COVID-19 or determine that you are no longer contagious. Some people who have COVID-19 only experience mild illness and can recover at home without medical care. They should stay home from work even if they don't feel ill. They should not be in public. I say this to some of you because some of you have left and endangered the lives of others by going to pick up a few things or simply disregarding a quarantine order. The law states that you can be arrested for purposefully spreading a highly contagious disease, so follow the law. Protect yourselves and protect others. Here are some other recommendations. Take care of yourself. Get adequate rest and stay hydrated. Take over-the-counter medicines such as Tylenol, vitamin C and D, zinc to help you feel better. Thankfully, we have access to monoclonal antibody treatments authorized by Food and Drug Administration for emergency use. We have been using these treatments designed to block viral attachment and entry into human cells. These antibodies neutralize the virus and can potentially treat patients with COVID-19. The antibodies were identified from blood samples taken from some of the first patients who recovered from COVID-19 in the United States. The treatments are most suitable for treating mild to moderate COVID-19 in adults and in pediatric patients aged 12 and older who are at risk for progressing to more serious or severe illness or hospitalization. We have successfully treated many Virgin Islanders who meet the medical criteria and will continue using the tool. Please do not wait to get worse to accept the antibody treatment. Many of you do so. It has also now been approved if you have been exposed to COVID-19 as a prophylaxis. So please, when we call you or you call us, let us know. Accept the help. So far, we have administered 349 total monoclonal antibody, or MAB as we call it, infusion at the Schneider Regional Medical Center. This, of course, includes Myra Keaton Community Health Center and St. John. 58 of those have been conducted in August. Today is only August 9th. 75 total monoclonal antibody infusions at Wong Louis Hospital, 13 of which have been conducted in August. People who recover on their own from COVID-19 can immediately take COVID-19 vaccines upon recovery. You don't have an excuse. Those who use the monoclonal antibody, however, can get the vaccine after 90 days of receiving the treatment. We must also be aware of the long-term symptoms people have experienced after recovering from COVID-19. COVID-19 long haulers may experience symptoms such as fatigue, body ache, shortness of breath, difficulty concentrating, headache, loss of taste or smell, or other problems long after the coronavirus have left their body, according to the World Health Organization. From our hospitals, the Governor Wang F. Lu Hospital and Medical Center reported 16 COVID-19 admissions, plus 1 admission pending the emergency department, with 3 patients ventilated, and the Schneider Regional Medical Center reported 9 COVID-19 admissions, with 3 patients ventilated. Hospitalization with severe illnesses continue to increase and to slow what we must accept COVID-19 as well as other precautionary measures we have seen work. So far, 47,192 individuals have received at least 1 dose of COVID-19 vaccines, and 38,268 individuals are fully vaccinated. Now, that's not enough. It's a good amount, but it actually only shows that 42.46% of the population have been fully immunized. We actually need to reach over 75%. We say 70 to 80%. Some individuals actually are looking at even higher than 80% because of the very strong Delta and other variants that are arising. We ask that anyone 12 and older who has not been vaccinated visit one of our community vaccination centers or call 340-777-8227 to schedule an appointment. You can also self-schedule by going online at COVID-19USVI.com/vaccines. If you are the parent or guardian of a child aged 12 and up, please make sure to accompany the child to his or her vaccination visit and bring IDs for both of you, as well as the child's birth certificate. We're also offering COVID-19 vaccines at our pop-up testing sites. Anyone can pre-register for pop-up testing online at COVID-19USVI.com/testing. The following are upcoming events. Please note, due to the expected inclement weather, the Tuesday, August 10th, which is tomorrow, pop-up testing will be canceled. But you can call the EPI hotline to be added to the drive-thru if you have symptoms or have been exposed to someone who has been positive 3 to 5 days after. Don't forget that. St. Croix at Charles Howard Complex, Thursday, August 12th from 10:30 a.m. to 12:30 p.m. St. Thomas at the Lionel Roberts Stadium, Thursday, August 12th from 12 p.m. to 2 p.m. St. John at the Virgin Islands Port Authority Gravel Yard, Wednesday, August 11 from 1 p.m. to 4 p.m. Again, these testing sites may be changed depending on weather conditions this week. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com. And for COVID-19 health information, alerts, text COVID-19 USVI to 888-777. I ask that you really and truly take heed to the public health warning. COVID-19 kills. The vaccine actually helps. Thank you, Governor.
Thank you, Commissioner, and thank you for that. This is still a serious time in the territory. You know, for the last month, it has been extremely stressful in the territory. I know for you, and certainly here at Government House, where we have to make the decisions. It started with the surge that happened in the BVI and over 1,500 cases being accumulated there, and so many people passing away. And then, of course, we got our share of it in terms of the surge that we are experiencing now, which I must say we are handling quite well, considering the veracity, is a good word, of the Delta variant and how quickly this contagion moves through our community. And you know, I just wanted to make sure that people understand that everybody's stressed out. I mean, my brother this weekend, I think he sent out like 100 different Facebook posts about why you should get a vaccine. And you know why? Because he's the paramedic that comes to pick people up when they can't breathe. And the stuff that they've been going through and what you have to do, all the stuff you have to put on, the protective gear, you know, it's like one ambulance run takes a couple of hours because then you got to decontaminate after it. And even with the stuff that we're bringing on, you know, our healthcare workers at the hospital, our EMTs, you know, our paramedics, our general practitioners, our respiratory therapists, these people are tired, and we're tired too. Last week, we jumped on the bandwagon early when we realized the hospital was being overrun, and we got Pafford to send us some extra nurses and respiratory therapists. We want to thank Pafford for always being there for us when we need to add extra personnel. That crisis is not averted. Certainly, we're still thankful and grateful, and send out all our prayers to our people at JFL and Schneider Regional that are battling this thing on a day-to-day basis, because it's not easy doing this. And you know, last week we had several meetings trying to decide what we're going to do in terms of restrictions, and it's a very different time for restrictions because This is the pandemic of the unvaccinated. I mean, JFL has on their poster, 0 patients are in the hospital that have been vaccinated. We don't have anybody in our hospital that has been completely vaccinated. So it really is a pandemic of the unvaccinated. And I mean, we were forced with a lot of decisions, and it made me contemplate this weekend, and I started doing some research on vaccines and actually found a real interesting site called The History of Vaccine. And truth be told, if you don't know your past, you'll be failed to repeat it. We have been through this. When you go on the site, you'll see we've been through that once, not twice, not 4, 5, 6 times. The same resistance to vaccine, the same protests by the public. All the things that we're going through, we've lived through it over and over again with polio, measles and rubella, and the Spanish flu, all of them. We went through the same exact thing. The court cases, do you know that in the first mandated vaccine by any state was Massachusetts in 1895, and in 1905, the Supreme Court of the United States actually upheld that vaccines could be made mandatory. So when we're making these rules, we have to think about what happened in the past and how we're going forward. And the road that we must take is one that we must continue to encourage and make sure that people get vaccinated, because this thing is not going away. So when we looked at what we wanted to do, we said, like, you know, the beaches are one place where we know we don't have the personnel to shut down every picnic and party. And even though there's a rule saying no DJs, no picnicking, no barbecuing, people are still doing it on the beach. So how do we control that? We close the beach at 4, give people a chance to take their dip. I know my morning crew out there in Frederickstead, Betty and them, they like to go in 7 o'clock in the morning. You guys could go, but 4 o'clock on the weekends, 4 o'clock, everybody off the beach. That way, you know, we could cut a little bit down on the alcohol dispensing and everybody getting merry, hugging up and giving one another the COVID. So the beaches starting Friday were going to be closed. Why we didn't do it this weekend? We didn't think it was fair to give people less than 24 hours notice, 72 hours notice about what was going to go on, which is why we didn't close down any businesses either. So we make sure, you know, at 4 p.m. until further notice, hopefully it won't be any longer than 30 days. Beaches close at 4, weekends and holidays. So after Labor Day weekend, we look at it and see what it's going to look like. Virtual learning. I know students go back to school today, so we're pushing back school another 2 weeks in terms of being able to go in. But we're really looking at the possibility to bring teachers in after this first 2 weeks is done, and then try to get in our younger students as they were already in school before this summer. We had a mixed learning bag. We're going to try to see if we can bring that back in, because we understand parents under a lot of pressure on where to take their children. Mass gatherings for other places is back down from 100 to 50, or half the capacity of your establishment, no more. 30 days, all these things I'm talking about, we're trying to get them in. We also removed the antibody testing from the portal. Why? Because now antibody testing is no guarantee that you're not carrying the virus or that you can't become infected from the virus. We need you to get the vaccine. We've still left that up. You know, the one thing that's being imposed everywhere is mandatory weekly testing for government employees unless you're vaccinated. Right now, we're looking at the resources that would be able to do that. For us as a government, it would put an extreme stress on our system as well, again, not only in terms of supplying the amount of tests we need, but also it would require us to have more labs do the work. And our concern, quite frankly, is we don't want anybody who's really sick not to be able to get a test, because we're testing to make sure that people go in to offices without being COVID positive. So I've ordered my commissioners, directed my commissioners and directors to start paring down government offices and thinning them out a little bit. That means that your stuff is going to slow down. That means everybody's things going to be run slower through the government. That means projects going to run slower through the government. But we got to be safe and we got to get people vaccinated. So I finally broke down and said, okay, we got to make sure we use every single incentive possibly to get people vaccinated. So From today until September 30th, every single person that gets vaccinated, the second shot will be issuing you a check for $250. If you will still be eligible to win the $100,000, but that's just an extra incentive now. For anybody who gets a shot from today until September 30th, your name will be selected when you get your second shot. So if you haven't got your vaccine, now you have another reason to get your vaccine. So now everybody who participates get a shot at it. And to everybody who had the vaccine already, you still get the opportunity to win the $100,000 like the people we're encouraging to do the vaccines. My businesses, I'm going to ask you now to really, let's try to get it under control. I know I've been relying on you greatly, but you've been doing a fantastic job. And the one thing that came to me is, why should we shut down every single business? There are people out there working hard to make sure that they're keeping their businesses good. So if your business is good, I support you. You call us, let us know what you need to keep going, what help you need. If you're having a problem with crowding, you can call the COVID task force to come and help you thin out your business or around your business. This weekend, I noticed people not in the places, but standing around the clubs and the nightclubs and stuff. We're going to have the police clear those people too. You're not going to be allowed to loiter outside. So once a business gets to capacity, that's where it will stay. If we shut you down for non-compliance, it's a 30-day wait window till after Labor Day to get a hearing. So please just do the right thing and comply. And I know so many of you have been doing the right thing out there, so continue to do that. Our Vax to Win winners, we are now in the 4th week of our Vax to Win vaccine lottery, where 2 vaccinated Virgin Islanders will be eligible to win up to $100,000. And here with us to announce the July 30th drawing is our esteemed director of the Virgin Islands Lottery Office, Mr. Raymond Williams. Mr. Raymond, Mr. Williams.
Good afternoon, Governor. Good afternoon, Commissioner and to everyone listening. It is definitely my pleasure to be able to announce today that our July 30th winners on St. Croix, Ms. Naita Salmon, and on St. Thomas, Mr. Raphael Farrington, both are fully vaccinated. They both won the $100,000, so the check is ready when you want to come get it. I have the checks ready.
Wow, I went to school. I think I went to school with Raphael Farrington. And Rafi, congratulations, man. That's a nice little thing to put in your pocket there. Congratulations, Naita, as well. You can get it too. All you got to do is get vaccinated, and you too will be in the drawing to make sure you could win $100,000. But most importantly, you will make sure that you will save your life and probably somebody else's life by not spreading this awful virus. As we have mentioned in the weeks prior, our back-to-school special drawings for school-based personnel was held today. 6 lucky winners have been chosen, 3 in each district. There will be a first-place winner in each district who will get $25,000, a second-place winner, $10,000, and a third-place winner who will receive $5,000. We will announce those lucky winners at next week's weekly press briefing. We have contacted them and we're validating their entry. Congratulations in advance to those winners, and thank you for choosing to protect yourselves, our student population, and our Virgin Islands community. It is much appreciated. Well, today is also the first day of school for our public school students who, as a result of the current pandemic surge, are returning to school utilizing our virtual learning, something we're not happy about, but we're forced to do. But we are looking forward to getting our students and our educators back in the classrooms this school year. Nonetheless, our goal remains, and we will be getting back to in-person learning very, very soon. We know that this is a less than ideal situation, especially for our younger students in kindergarten and primary grades. And we have so many people now enrolled in our Granny Pre-K, of which I think we added 5 new classrooms this year. And we know it's less than perfect for the parents of those students who have to figure out how to deal with that. The Department of Education has announced that they will be resuming their No Child Goes Hungry program as well, which allows children at home to participate in virtual learning and get a hot meal. I wish all the children of the Virgin Islands a safe and prosperous school year. Finally, a special appeal to our parents as we hand out MiFi devices, laptops, and other resources to assist with virtual learning. Please remember that these tools are government property, and when we are done, we need to utilize by another student, just like the desks and chairs in our classroom. So please help us take care of them and make sure we keep that going. In our continued effort to make sure that our frontline workers do what is necessary to protect themselves, their coworkers and loved ones, and the public, we are continuing our Vax to Win drawings. See, we're doing every single thing possible to make sure that you are motivated and incentivized to get vaccinated. So we're doing one just for health and healthcare workers. This is in addition to ones that are being run at the hospitals. We gave them money to do that too, but this is for everybody. This is a special drawing for if you work in a clinic, hospital, private offices, you're a school nurse, physician, EMT, any type of healthcare worker. We will be announcing 3 winners in the district in October. It'll be October 12th. Of course, first prize is $25,000, second is $10,000, and third prize is $5,000. 3 winners will be selected for each district. You can win too. Register at vaxtowinusvi.com, or if you do not have access to the internet, you can call Vitima's hotline at 777-8227. Other than that, you can register at our community vaccination centers. The last day to register your entry into this drawing is October 1st. To win, you simply have to prove that you were employed at a healthcare or allied healthcare facility at the time of the drawing, that you have been fully vaccinated in the Virgin Islands, and that you are indeed a resident of the territory. In other news, we're still trying to update the public that none of the U.S. territories have yet to receive the funding from the U.S. Department of Treasury for the child tax credit money. That's $300 per child that you're supposed to get. We're still waiting for them to send it to the territory, but we do anticipate getting this funding shortly and the payments to begin to Virgin Islanders before the end of the month. So instead of 6 payments, we will release the same amount, but truncated over 5 payments between now and the end of the year. This is just another one of the challenges of being an unincorporated territory as opposed to being an incorporated territory of the United States. Other thing that just adding more to the plate than what we have to manage here, we still have a storm advisory in the territory that we're watching. We're actually watching 2 tropical disturbances in the Atlantic, and the National Hurricane Center reports there's a 70% chance that 94L can turn into a tropical cyclone over the next 2 days. While taking the necessary precautions, please remember that global warming is showing us time and time again that these storms can change very quickly. And according to the most recent NOAA advisory, any tropical watches or warnings that may come with this storm may come with less than the usual warning time to prepare. We do anticipate the potential for tomorrow flash flooding across the territory as a result of this system. As usual, the talented team at Vitima is on full alert, and if the situation becomes threatening, we will update the public. We are in the middle of hurricane season, and we must be prepared. We must be vigilant. If you have not already done so, please sign up for Vitima's alert. I think everybody in the Virgin Islands should be on that by now. You get your COVID information as well as any weather threats, any earthquakes, anything else or weather-related coming to the Virgin Islands. So please make sure you sign up for that. As an additional incentive now, like I said, and between October 8th, we will be making that payment of $250 to every resident who becomes fully vaccinated in the territory. I just want to make sure you heard it because I'm going to say it again. This past weekend, I had the pleasure of spending time with the Honorable Governor Pedro Pierluisi of Puerto Rico. As I attended the Blue Economy Summit, where I was a guest speaker and had the opportunity to discuss efforts in our administration in taking to the efforts our administration is taking to diversify our economy. I also had the opportunity while I was there to sit and talk with Governor Pierluisi about a lot of things. And one of the things that I think was very important is Puerto Rico being the center of the Eastern Caribbean islands and how important their ports are. Their airport in terms of us being able to get transportation to and from the mainland and to our sister islands, and Puerto Rico as a home cruise port, which is very important as well. I found the conversation very encouraging. Governor Pierluisi is a very experienced and very nice guy. Invited me over to Puerto Rico again so we could talk about some other issues. But I think we have to forge a better union between the entire Caribbean and Puerto Rico as we move forward to make our economies better. In Congress, we are working on several things together, transportation, of course, FEMA, working through the HUD regulations that we're doing, and also several tax issues, as well as Social Security benefits, Medicaid, and Medicare. So with all those things in common, we agreed to work together to make and bring both the territory and the Commonwealth of Puerto Rico forward as leaders in the Caribbean. I also had the opportunity to visit the Veterans Administration healthcare system in Puerto Rico. I met with its executive director, Carlos Escobar, and I'm pleased to announce today some amazing and exciting news for our veterans who depend on the healthcare system. Thanks to the collaborative effort between our Veterans Office and Director Farrell here and working with the Puerto Rican veteran offices, they have actually gotten together a charter airplane just for veterans, one from St. Croix, one from St. Thomas, once a week, where we will be flying our veterans over to Puerto Rico for free. Once they get there, there will be a bus at the charter for them, and then they will take them to the Veterans Administration, where they will be prioritized as first in line on people to get through, and because they have to get back on that charter in the evening, which will transport them back to their respective islands, whether St. Thomas, St. Croix, or St. John. We were really happy to hear that. We actually took a tour of the hospital, beautiful facility. I was kind of amazed at the amount of services veterans have. Even in vitro fertilization, they had a women's clinic that we toured for OBGYN, auditory services for people who have hearing loss as well. And they said that they want to be the place of choice for veterans. They're also trying to expand services in the Virgin Islands by making sure that we have access to doctors that can, and the hospital that can then build the Veteran Administration, but also to have the expansion of home-based care. So they are putting together a team on both islands now that will actually visit veterans in their home and give care to them. They'll be equipped with doctors, EMTs, and nurses and home care assistants that could help those veterans take better care of themselves. And it was an awesome opportunity. Of course, I was joined there by Director Farrell, our Commissioner Hussein Encarnacion of Health, as well as the both CEOs of the hospital, JFL and Schneider Regional, were on the phone with that call too. So very positive news for our veterans. So our Puerto Rico trip was quite productive. We also realize in the blue water economy, we are doing a tremendous amount of work, whether it's the work we're doing in terms of cargo reinforcement with the $23 million project in St. Thomas, the expansion of the Adelita Cancrine School, the moving of the Gallows Bay Pier over to Crouse Lagoon, the $20 million warehouse that's being built there, and another $65 million grant that we're applying for to reinforce the cargo facility in St. Croix, to fishermen, the different fish ramps we were repairing, the one in Crouse Lagoon, one at Hull Bay in St. Thomas, and others that are having repairs done to them, as well as the money that we're putting towards workforce development in terms of supporting our captains and people who work in the industry around maritime. So it was a very good meeting. I'm very empowered by what I saw there in Puerto Rico and encouraged to work more with our Puerto Rican neighbors as we expand marine economy. That's it. That's all I have for you today. If I have any questions.
Good afternoon, Governor.
Good
afternoon,
afternoon,
Commissioners and Director. Susan Ellis with The Source. I have a few questions today, so please bear with me. We're wondering, number one, with the healthcare workers, how will they be replaced, and how many people have been supplied by Pafford? There are people that are threatening to quit if they have to become vaccinated. And so we're wondering how you're going to cover those losses of staff.
Well, I mean, the people are quitting anyway because, first of all, because they're just tired. I mean, it's been a year and a half. It's working 24 hours. So we're losing a lot of personnel. We're doing some things to incentivize healthcare workers. Some of those things are good things like pay and being able to get them mental health and other types of release. And then we're also trying to do other things like supplement, because you can pay somebody as much as you want. When you're tired, you're tired. Pafford was never brought here to replace anybody. We just gave this to give our health workers a break because they get tired. The vaccine protocol in the hospital is always been the vaccine protocol. We just added a vaccine. Healthcare workers are already required to take vaccinations as a condition of their employment. And that's not anything new. Further, I think there is a place where for people who are opposed to the vaccine to submit for a waiver to the HR for the hospital as well too. So.
I actually sent the application to both ICUs this morning so they can, of course, send it to their HR department, and that's where the staff would be able to accept or receive that document so that they can bring it to the Department of Health, requesting a waiver. Of course, that waiver has to be accepted, and it focuses on strictly religious purposes as well as medical reasons why they should not be vaccinated. And it's never the intent and never want to lose any of our local staff, as the governor is saying. Pafford has actually been here with us after the 2017 hurricane, so they're not new to the territory. And they first came to assist with nurses actually going into the homes as well as EMS, and they have continued to do so. And just to let you know, it's not just the registered nurses that we're concerned about, it's also the support staff, the person who actually, the secretary who answers the phone, or the CMAs or CNAs who are support for the nurses, the LPNs. So we're actually trying to support both hospitals from all levels. It has nothing to do with vaccination.
Even before this, up to over 2 weeks ago, I had already authorized both the CEOs of the hospital to increase their hiring. And if, I told them, I said, I don't care how much money we have to pay the nurses to come to work, and let's pay our nurses the same thing too. But let's hire them and let's try to get the contractors up, because we pay an exorbitant amount of money having these contractors here. So if this is what the cost of a nurse, respiratory therapist, EMT is, we'll pay that, because we are equipped with the cash to do it. But all we want to do is make sure that our people don't get burned out, and that the people who go to the hospital are given care. The one thing that people are not realizing, and they need to pay attention to, this isn't only about COVID, because what happens is once it fills up with enough COVID patients, then there are no more beds. So if you have some other ailment, because the census in Schneider Regional this morning is 72 or something like that, which is high. And only 10 of those patients are COVID. There's 62 other patients that are in the hospital. Once the hospital gets overwhelmed, general services get reduced. Like right now, elective surgeries are being taken off at JFL because we can't, and being considered at Snyder as well, because we can't keep putting people into the hospital for care if we don't have beds. So everyone is affected. We're not doing these things because we want to push against people's civil liberties and their rights. We're doing these things because we have to for the community. I asked myself last night, if this was Ebola, and people were bleeding through their eyes and dropping down dead in the street, would we feel the same way? There's no degree of pandemic. This is a global pandemic, and I think we've gotten kind of used to it and comfortable in our situation. But the reality is, this is a deadly global pandemic, just like Ebola or anthrax or anything else that could get out. And God forbid, I hope not, but this seems like a trial run to something that's going to come down even more heavier than this in the future. So we got to get this right.
Right, correct. A follow-up to that, the workers that are maybe exempted because of religious reasons or whatever, and until everyone is vaccinated, how often and how soon will you start doing testing for people that are not vaccinated?
There actually, and I don't have it in front of me, there's a
Yeah.
policy that actually is going to guide when they will be tested. I think the deadline for putting in an application is actually in a couple of days, so it'd be the 12th of August, as well as looking at when they should have their first and second doses of vaccinations, and then, of course, all the implementation goes from there. So there's a really, it's not immediately being implemented, it's actually being implemented in phases, which allows them the opportunity to really make up their mind, read a little bit more, make the best decision for themselves. But we're hoping that the best decision for themselves also includes the best decision for the organizations as well.
But testing will begin for the people that are non-vaccinated.
Correct. Those
There's a
are,
timeline that they established, right? I think it's like the 24th or
the
something.
19th is
Okay.
the last day. However, you have to remember that in terms of the vaccination piece and the testing piece, that we're going to be working with Dr. Ellis and her team to ensure that the testing begins. So when that final date of the 19th comes along, then we will start completing the testing weekly for them as well. And so the testing actually can be done at the hospital, but they've requested the assistance of our epidemiology team. I actually have Dr. Ellis sitting in here just in case you have some epidemiology questions for her as well in terms of vaccines. And I think it's important because I don't think everyone understands how a vaccine replicates and why it replicates the way it replicates and why we have the variant. So
The virus.
right, how the virus replicates into variants, and why it replicates into variants is because it's just standing. It's standing and no one is actually, there's no way to combat it. Your immune system is really and truly what helps to fight it. And if it's not there, it's actually going to take advantage of you, and it's going to replicate into something that's even stronger, and that is exactly what it has done.
Right. And do you have any ideas about about the people that have been in and are in hospitals now? What kind of reaction? Have there been any reactions to any of the treatments? Have we had any long haulers, as they call them, in the hospitals, or do you know of any? And is there any record or any suspicion that anybody here that's been vaccinated has been infected?
Okay, so we have actually not had any adverse events surrounding monoclonal antibodies, I can say that. There are some, renal disease is one of the contraindications for receiving some of the medical countermeasures. I just spoke with Dr. Hunt about that this morning, but we have actually, she actually guides all of that, so we have not actually had to encounter a mishap with that because she's actually there ensuring that all of the questions are being asked. So one of the things that I think is assisting us is the consistency of having Dr. Hunt being accessible to both hospitals in reference to the medication as well as the other than medical countermeasures in terms of proning. Those, all of the same measures that were employed in the beginning still take effect today, and it's still consistent.
So out of the 47,000 people who have been vaccinated, I think it's 65 that have actually tested positive.
Oh, okay. And were any of those hospitalized?
None.
Okay. And do you know of any people suffering from the long haul effects?
Lots of people. We have people who have moved from the regular ventilator to the trachea. They've been in the hospital on the ventilator so long. And then we have people who have are no longer hospitalized but are seeking other care for ailments caused by the virus. So people who had COVID last year still are going to the hospital to attend to complications from which the disease created, the virus.
And you can see complications looking at renal or the kidney, cardiac or the heart. So you see those kind of complications. It may be as simple as taste. I know many people who have actually, after a year, not regained their taste, which is just as simple, but then you have the major effects of the heart and the kidney.
I've heard so many different things about the disease, everything from like taste to erectile dysfunction to people who need transplant. There's so many different facets to this virus. We're probably going to be learning more as the time passes on.
I think that what's important to note to the general public also is that the younger population is also being more affected by the Delta variant. That's critical for them to know.
Kids are getting sick, like hospital sick. I've seen that a lot on the news. That's disturbing as well.
So do we have any children in the hospital now?
We have one at RLS. I think within the last few weeks, we've had 3 in totality.
Wow.
But there's something around with expectant mothers too. We've had quite a few mothers in the territory that test positive for COVID. Strangely enough, every couple of weeks we have one in postpartum.
And there is no counterindication for pregnant women receiving the vaccine, so they can become vaccinated.
Oh, well, that's good to know. Okay, so looking at the whole picture, how do you think the low rate of vaccinations is affecting our economy and the community as a whole?
Well, more so, it's not affecting the economy. I mean, the economy is doing fine. It's affecting the healthcare system, and certainly it's affecting government services because we have to keep closing offices. So it's affecting the community in a wide way. And, you know, the 40 people who have passed on, it really is affecting their family. I always try to remind people that our whole goal in this is not to keep COVID out of the territory. It's to make sure that we can attend to people when they get sick. And we're faced with it. Last March, we didn't know what to do. But now we know what to do. We get vaccinated. And we're not using that. It's almost like swimming out to somebody to save them from drowning, and then they don't want you to help them. They won't get on the life raft. They won't grab hold of the float. And it's very frustrating to me because, and then it's more frustrating when you hear people die because, you know, it just doesn't need to. And what's even scarier is, you know, I have people that work with me that can't take the vaccine because of their health conditions or whatever allergies they have. Like, you're endangering those people who don't have that choice. And I mean, they don't have any defense against the vaccine. So if they're exposed, you know, they're in real trouble. And we have a lot of people in the territory. And we're watching this thing. It says like 95% of the people who actually die are hypertension, diabetes, and obesity. You're describing our population. And that's the real scary part.
What we're speaking about right now, Governor, is behavioral health. You know, just looking at both your faces right now, I actually see concern on your face. That's a reaction. That's a behavioral reaction. And that's a minor reaction compared to those who've lost family members who have actually suffered from COVID-19. And so the effects are not just monetary, but it's psychological, emotional, and it's behavioral. It's a stressful environment for each and every one of us. So it's that balance that we actually have to come to.
Okay, and one last question. Do you foresee requiring, mandating vaccines in government offices? And if so, would it be an overall requirement, or would each department set their own rules?
No, like I said, you know, right now we're using as much as a carrot as possible, encouraging people to take vaccines, but we're also preparing our testing capability in order to do that. So, like, we could, and I don't like to say mandatory vaccines because it's mandatory testing. But if you have a vaccine, you're exempt. And that's just to keep everybody safe. But right now, we figure 50% of the workforce isn't vaccinated. We have 6,000 employees. That's 3,000 people testing every week. That's an overload on our system. So we have to do some things to test up, get the kits ready. But rest assured it's coming, because this 250, my goal is to get 15,000 people vaccinated. If we can do that, if we could get 15,000 new people vaccinated, then we're good. We have meet our goal, right? Could be the 60,000, 65,000. Don't take it higher.
I'm taking it higher. Have to take it higher. I think it's important to say that if we test every week, which we will be testing every week, once you test and you were symptomatic 2 days prior to testing, you've already exposed others. So that's why the vaccine trumps all countermeasures.
Yeah. Like I said, when you go through history, it's not the first time we push vaccines, and it won't be the last. It won't be the last of the last of the mandatory requirements. But I just want to take a minute too to, like, in the whole Caribbean, I mean, it's all black and brown people, and you know, St. Vincent, they hit the St. Vincent. The Honorable Ralph Gonzalez, their prime minister, with a rock the other day, bleeding. I mean, like, people are stressed out because of this, and because they put a mandatory vaccine mandate on their city workers, but they're at like 14, 15%. We're at 50%. We got a ways to go, and they got even worse to go. I mean, think about all these people in the Caribbean and the sufferation that they're going through in these countries. They haven't had any tourism for over a year and a half now. How are these people eating? And the end is nowhere in sight. We blessed to be able to at least have vaccines. They don't even have the vaccines to administer. We're doing our best to help our friends in the BVI, but the economy, we good. We could shut down, but it doesn't account for all those people that are going to have to go line up at unemployment insurance, waiting for checks, and go to food stamps, and don't know how they're going to put food on their table. Got to wait for stimulus checks to come, or, you know, we need to worry about those people. I got to make sure they eat. Government workers, you're going to eat regardless. But there's 70% of us that don't work for the government. And, you know, how are those people going to eat? You know, right. That's what, you know, it's tough decisions. But we got to do what's best for the entire territory.
Okay, thank you.
Thank you, Susan.
And good luck.
Ernest?
Hey, Governor, how are you?
I'm good. How you doing?
I'm good. A few questions. This is about a little this one. You changed your mind on making things a little bit more difficult for the unvaccinated?
Well, I mean, in essence, that's what it is. Our strategy is not purposely make things more inconvenient for the unvaccinated, but the vaccinated people did what they're supposed to do. We're not going to make them suffer. Everybody suffer as a result of people who don't want to get vaccinated. For whatever reason it may be, we're going to make the laws that benefit the people who have taken their vaccines. So if you want to get a cotton swab stuck up your nose every single week, then so be it. So that's what I mean by a little bit more difficult.
And so you don't have a timeline as to when that would take effect. You're saying you guys are testing capacity now.
We're shooting for August 9th, but we're hoping we don't have to do that, because if we get 15,000 first shots or close to it coming up to September 8th, the day after Labor Day, you know, we won't have to do that. We'll be good. Well, so we try to give people money, you know, here, there's another shot, another 250, you know, go out and get vaccinated.
All right, Gov. A few more questions quickly. Someone had this concern that folks who are vaccinated elsewhere. So I guess this is a question before I ask. Are we allowing vaccination on sites that are not controlled by the Department of Health?
Yeah, but they report their numbers to health, because we have one, what's this, the BAM system, everybody?
Yeah, everybody goes through the BAM system. It's not the most effective system, but everyone goes through. So we can access everyone within the territory.
Okay, so the concern with that was the portal isn't reading some of those vaccinations. You've had any reports of that?
Remember, it's two different systems. I think we explained that last week. The portal is one system, and then the what's it called? The other system for the vaccination card to be verified. They're two different systems. The travel portal and the the Polaris system. They're two different systems. So what people are complaining about is that they're putting their card into the travel portal and it's not picking it up. So there are some little discrepancies between two systems. We're working that out. But the BAM system is what keeps all of those records.
We actually are
Okay.
having a little delay with the system, and so we're actually meeting just to make sure. So just to let the community know, bear with us. We're still working some kinks out. We're meeting today. We're coming up with some ideas as well as making some decisions as to how we go forward as well.
Okay. Thanks for that. A few more questions quickly here. Governor, what's your position on UVI's mandate? So you had two protests today, St. Thomas and St. Croix. We visited one of them, and folks had their concerns. Again, the drug is not FDA approved. It has emergency approval. FDA is working to approve it by next month. You know, just folks with the regular concerns. Why not give them an opportunity to test weekly as compared to mandating such? You had a few students who spoke about that, and there are even reports of UVI firing folks. What is your stance on that? What is the official stance on the mandating of COVID vaccination by UVI primarily, and also the hospitals?
I mean, these are people's children, right? I mean, I wouldn't want my kid going to school with somebody who has Ebola if there's a vaccine against it. I would want to make sure that everybody who was in that situation was vaccinated. I want to make sure my kid's safe. I am giving UVI a grant so that they can do upgrade their system so they could do telework. But for now, that's the rule. I'm going to support every mandatory push to make vaccines more accessible and used by people. I'm going to support it. In the private sector, we support it too. We have to get to this herd immunity. I love when our young people protest and they make it clear what their concerns are. But, you know, we're paying for most of them to go to UVI for free. You know, all we're asking is that you become vaccinated in order to attend the school. You know, all the schools in the States, they're having the same vaccination requirement. I don't hear anybody protesting, them going online protesting about their school not having mandatory vaccination. So, I mean, these are times for leaders, and I mean, I think this is one time where we all have to stand together and push for us to get to a point so our public health system can get a break, so our people can be safe, and so we could stop people from dying of this unnecessarily from this virus.
Thanks, Gov. Quickly here, do we have an idea, because I know the British government has been very successful in determining, they're fully open right now, you know, they've gone through the Delta variant, and they know how many folks vaccinated, as well as how many folks received natural immunity from prior infections. Do we have an understanding as to a percentage of folks who may have gained natural immunity based on prior infection? That would give us a clearer understanding as to vaccination, natural immunity, to get to that number we're trying to get to.
But if you, I mean, they can't know for sure, but I mean, just like us, we know how many, I think it's about 5,000 people in the territory that have already been infected. And we know how many people had first shot, that's 47,000. You could figure about half of those people who've been infected had at least a vaccination by now. So you get right around 50 minus about 2,000 or 3,000 tourists But Dr. Ellis will answer you, so I'll let the professional do it.
Just to add to that, there's not a lot of value in that data because if you've had COVID before, again, you can get it multiple times. I know you posted the article that CDC just came out with, that if you've had COVID before, you're twice as likely to get it again. You're not protected against any of the other strains, so having immunity to a previous infection doesn't have a lot of value. You still need to get the vaccine. So the most important number is how many people in the Virgin Islands were vaccinated.
All right, Dr. Ellis, thank you. And lastly, I guess this is for everybody, primarily the governor, of course. Do you think, so this is a concern that I've gotten here, do you think that we have been too aggressive in the manner we push vaccination, that instead of having the effect of winning folks, we are actually losing them in the manner we are pushing vaccination? So a very aggressive stance, just everything that has been going on. Do you think if our language or messaging was a bit different? So perhaps we say, listen, it's your choice. We know there's a choice. It's up to you, but we're letting you know this thing works. I'm just saying. Some folks have
Ernest,
said,
we're giving away $100,000 every week for 2 weeks. $100,000 for 10 weeks in each district. We've been more than accommodating, and now we're going to pay people another $250. We have at least 3 more additional drawings, and then I gave Port Authority, WAPA, and the hospitals money to do their individual drawings to encourage people, incentivize them to take vaccines. We've built complete vaccine centers. We've sent out vans to the undocumented to let them get vaccines because they didn't want to go to some place with so much guards. We put up pop-up shops in Home Depot and every place else. People who ain't gonna get the vaccine are not gonna get it. All I wanna make sure that if there's an inkling of a chance that you might take it, I wanna give you every single encouragement to go out and take it, because I don't want to come visit you in a hospital or at any one of our funeral homes. So I think we've been, and I ask myself this as a leader, and I have to talk to myself, because this is not about don't like politics and nothing. This is about survival. The one thing that has allowed human beings to live this long is the ability to adapt. You adapt or you die. And this is one of those moments where we're going through a practice where we have to adapt. And we have the adaptation tool. We had our first movers in the first 3 months, and then we had our second movers in the third 3 months, and then in the second 3 months. Now we're going through 7th to 9th month, where we're gonna have to have the people who are really unsure, the last bit of movers, to go in there and take this vaccine. So to those people, I'm giving every single inspiration, incentive to try to do it. Please. To the people who ain't ever gonna take it, one day you'll thank the rest of us for making an ultimate sacrifice to keep you safer. But all we need to do is get to that 75, 80%, and we could breathe a little bit easier and get about our business again like normal people.
Gov, thanks.
Thank you. That's it. Stay safe, stay sanitized. Love you. God bless.